In my Medicare overview video, I discussed how original Medicare is made of two parts, Part A and Part B. If you haven't yet seen that video, I do recommend watching that first, just to get a good general idea how Medicare works overall. Medicare Part A is related to your inpatient or hospitalization coverage. In your benefit period, you're going to have that $1,556 deductible. Once you meet that deductible, you will then go into a schedule of benefits that are based upon days of service. And again, these days of service fall within your benefit period. To break down the days of service here, we have days 1 through 60. These are going to be no additional cost to you. It's essentially a free stay. Once you go beyond 60 days, 61 through 90 days, you would have an additional cost of $389 per day. Again, this is during your benefit period. 91 and beyond, you're going to be responsible for $778 per day. And these are based upon lifetime reserve days, which you only have 60 lifetime reserve days. These do not reset with a benefit period. So if you were to reset your benefit period and go beyond 90 days, you are then responsible for all of the costs. So while the scheduled benefits I just detailed apply in most cases, there are a few exceptions, such as with home health care. So for home health care, there is no charge for home health care services. However, you are responsible for 20% of Medicare approved amounts of durable medical equipment. When it comes to a mental health inpatient stay, you will follow that general schedule of benefits I've just detailed. However, you will also be responsible for 20% of Medicare approved amount for mental health services that are provided either by a doctor or other providers while you're inpatient at a hospital. When it comes to hospice care, there is no additional charge. However, you may have a copayment of no more than $5 per prescription for pain relief or symptom control. In a rare case where your drugs are not covered under your hospice benefit, you'd want to have your hospice provider contact your medication or Part D coverage plan to see if they cover the medications there. Also, when in hospice care, you may need to pay up to 5% of the Medicare approved amount for inpatient respite care. And lastly, Medicare does not cover any room and board for hospice care that you receive at home or another facility that you live at, like a nursing home. When it comes to a skilled nursing facility, there is a different schedule of benefits. So days 1 through 20, there will be no coinsurance for those days. Days 21 through 100, you will have to pay up to $194.50 per day. And days 101 and beyond, you would be responsible for all of the costs. It's important to understand how the Part A benefit period works, as it's not an annual benefit period as you may expect. Instead, the benefit period for Part A is going to start the first day that you are admitted to a hospital. Then once you are released from the hospital, it will continue for a minimum of 60 days. Now, any services that you're going to need from a skilled nursing facility would be included in this benefit period. However, once 60 days has passed, if you need to be readmitted to the hospital, then you would start a new benefit period. This means that you're going to have to meet the deductible again, which is at $1,556. Your days of coverage will also reset. It's very important to remember that you only have 60 lifetime reserve days for hospital stays beyond 90 days. So if you've used up all of your lifetime reserve days and you stay beyond 90 days, you'd be responsible for the full cost of your stay at that point. And the last thing I want to mention here is what Medicare does not cover. So Medicare does not cover private duty nursing. They do not cover a television or a phone in your room, and they do not cover a private room unless it is deemed medically necessary. As you can see with Part A coverage, your costs can add up very quickly. And this is where either having a supplement or an Advantage plan in place can really help. Medicare Advantage plans are going to have their own scheduled benefits for all these things we've discussed. When it comes to Medicare supplement, it's pretty much more straightforward. With the Plan G, which is the most comprehensive plan, all of these services are taken care of. So the per day costs that we've discussed really aren't a concern. Yes, you have a higher premium up front for those Medicare supplements, but you can see it really pays off in the end when you don't have to worry about all these additional costs for things like skilled nursing facilities and inpatient care. Now I'm going to go into more detail about what Part B covers. Part B has two main areas of coverage. It's going to be your medically necessary services and your preventative services. I'm going to read right from Medicare.gov to define both of those. Medically necessary services are services or supplies that are needed to diagnose or treat your medical condition that meet accepted standards of medical practice. And preventative services are just as they would sound. This is healthcare to prevent illness, like the flu, or to detect it at an early stage when treatment is most likely to work best. Now, you don't pay anything for most preventative services if you get the services from a healthcare provider who accepts assignment. An assignment is essentially if the doctor does or does not take Medicare. This is a topic I go into more depth in another video as it gets a bit complicated, so be sure to check that out to fully understand how assignment does work. Now let's look a little bit closer at what Part B actually covers between those two categories. In Part B, you're going to have coverage for things like clinical research, ambulance services, durable medical equipment, mental health, either be inpatient or outpatient, or partial hospitalization, and limited outpatient prescription drugs. With preventative services, things are more defined and standardized. You're going to have coverage for things like vaccines, annual cancer screenings, lab work, and mental health counseling. And you'll get most of your preventative services during your annual wellness visit. In addition to preventative services, Medicare Part B is also going to cover certain outpatient services that you receive while at a hospital. This will include surgeries, diagnostic imaging, and chemotherapy, as well as dialysis. And if you are administered or given prescriptions while you're there at the hospital as outpatient, then Part B would also cover these medications as well. While Part B does cover many outpatient services, it's important to note what Part B does not cover. So you do not have coverage for dental, vision, hearing, or prescription drugs overall for the most part, again, unless you are administered those prescription drugs while at a hospital as an outpatient. Medicare Part B only covers what is deemed as medically necessary, and any non-Medicare participating provider services would not be covered by Medicare Part B. So just to recap, I'm going to go over what is and is not covered by Medicare Part B. So what is covered are your annual physical exams, laboratory tests, that's going to be things like x-rays and blood work, medical equipment, things like wheelchairs and hospital beds, orthotics and prosthetics are covered, your mental health care and your ambulance services are all part of the Part B coverage. Things that are not covered in Part B would be long-term nursing home care for more than 100 days, acupuncture or naturopathy or any similar services to those, routine foot care, cosmetic surgery, hearing aids, dental care and dentures, and care outside of the United States is not covered by Medicare Part B. Now this is very important to understand, as original Medicare Part A and B only cover your inpatient and outpatient services, and there are limitations as far as some of your outpatient services like the dental, vision, and care outside of the US if you intend on traveling. And a lot of these are addressed either by supplement plans or Medicare Advantage plans. Medicare supplement plans are going to have some of the better coverage overall, while Medicare Advantage have some more cost-friendly budgeting options available. I go into more detail about both those in my Medicare overview video, but I also have individual videos that delve into more specifics on each of those coverages depending on which one is best for you. I recommend watching those so you get a better understanding about the options available for both those products, Medicare supplements and Medicare Advantage, as those are complex topics on their own. If there's anything that's still not clear or you have any specific questions, just add a comment below or you can email me directly. My email is in the description along with a link to my calendar. There you can set up a free 30-minute consultation to speak with me one-on-one about any questions or particular needs that you have. If there's anything that you'd like to see me cover, just let me know. I'd be glad to do a video on that. I do appreciate you viewing today. Thanks for watching. If you found the information in this video helpful, you know what to do.